Hi.
My name is Angela. I'm the nurse practitioner that'll be seeing you today. What brings you in?
I started a new job and I need a physical.
Oh, congratulations. We can definitely do that. Can you give me your full name?
Joanna Rizak.
Okay, and then how about what day is it today?
August 4th, 2023.
Perfect. I almost caught you there. And then how did you get here today?
I drove myself.
Okay, so general survey. Patient is well groomed appearing, breathing is non-labor, she does not appear in any distress. Speech is clear, alert and oriented ×4. So we're gonna go ahead and look at the skin basically throughout the assessment. We're looking for any discoloration, lesions, redness, any masses, anything out of the ordinary. I'm gonna go ahead and feel your skin for temperature, making sure that it's warm, and it is. It's dry. Testing skin turgor. She is well hydrated. Great. We are looking at your head, the cranium shape. Everything is symmetric, normal cephalic, atraumatic. Looking at the scalp, there's no redness, no lesions. Looking at the face, everything appears symmetric. Everything is moving symmetrically. I'm gonna go ahead and palpate your head if that's okay.
Yep.
We're palpating for any masses or lesions, any step-offs. Everything feels good. No tenderness. Okay. And then I'm gonna go ahead and palpate your face. Let me know if anything feels uncomfortable. Feeling for any masses, any deformities. Everything feels good. I'm gonna go ahead and palpate your sinuses here, your frontal, any tenderness, and your maxillary, any tenderness, good. I'm gonna go ahead and take a look at your ears. No discoloration noted, no drainage. Auricles look good. I'm gonna go ahead and palpate. No lesions, no areas of roughness. Everything looks good. Looking at the nose, the nares are normal colored, no redness, no drainage from the nose. So I'm gonna go ahead and we will take a peek in your nose. I'm gonna have you look up for me. We're gonna look in this nair. Perfect. And the other one, nares, your nasal mucosa and your turbinates are pink and glistening, and that is what we like to see. I'm gonna have you test your nasal patency by plugging one nostril and breathing through, and then the opposite. Nares are patent, great. I'm gonna go ahead and look in your ears. All right, perfect. Other side, perfect. No drainage, no redness. Tympanic membrane is pearly white. Light reflex is noted bilaterally. I'm gonna go ahead and have you close your eyes. I'm gonna palpate your eyelids. Any tenderness? No. Lesions noted. I'm gonna go ahead and palpate your lymph nodes. Pre-auricular, post-auricular, tonsillar, submandibular, submental, occipital, we forgot back here. And then we have anterior cervical and posterior cervical. Any tenderness felt? Nope, and those were non-palpable. All of that is expected. I'm gonna go ahead and look in your mouth. So first I'll have you, lips are normal appearing, they're not overly dry. I'm gonna have you smile and then clench your teeth for me, and that tests cranial nerves 5 and 7. I'm gonna have you stick your tongue out and then move it side to side, and that tests cranial nerve 12. I'm gonna take a look inside your mouth with my light. And buccal mucosa is pink and moist, no lesions, no petechiae. I'm gonna have you stick out your tongue and then say ah. Uvula is midline, tonsils, no exudate, no swelling, they're about a 2+. And then that tested cranial nerves 9 and 10. The teeth looked good, no problems with dentition. We're gonna go ahead and look at your eyes in a second here, but we'll start with a vision screening. So I have this Snellen chart here, and I'll have you cover up one of your eyes and then read the last line for me.
LTFPH.
Great, and then other eye, and then read it backwards for me.
HPFTL.
Great. So that tests cranial nerve 2, and her vision is 20/20, so that's great. We are now going to look at the external eye. There's no lid ptosis, there's no lesions, no exudate. The lashes are evenly distributed. Her hair is evenly distributed. No problems there. Sclera is white. There's no redness. I'm gonna pull down your eyes here. Conjunctiva are pink. Again, no redness, no exudate. I'm gonna go ahead and look in your eyes now, so you'll just look straight ahead. All right.
Great.
Red reflex is present bilaterally. The eyes, the pupils are round, symmetric. The optic discs have clear margins. And I'm gonna have you look again ahead right at the bridge of my nose. I'm gonna shine this light, and then here. So pupils are pearl. Pupillary response was brisk, of course. Now we're gonna test cranial nerves 3, 4, and 6, and we're gonna do the 6 cardinal gazes. So I'll have you follow my finger with just your eye, okay? Or your eyes. Perfect. So EOM is intact in all fields. Okay. So we did your eyes, we did your ears, we did your mouth, we did your nose. Now we're going to move on to your neck. So I'm just looking at the neck, making sure there's no lesions, no rashes, discolorations, masses. Everything appears midline, trachea appears midline, thyroid. I'm gonna have you look up and then swallow for me. Thyroid appears normal. I'm gonna go ahead and palpate your neck for, again, masses, lesions, any areas of tenderness. Trachea is midline. Go ahead and swallow for me again. Great. Thyroid is smooth, no nodules. Perfect. I'm gonna go ahead and palpate your carotid artery. And then on this side, I'm gonna take this opportunity to listen with the bell of my stethoscope. And there's no bruit. No bruit there either. Perfect. I'm gonna go ahead and check your TMJ here. So I'm gonna have you open your jaw and then move it side to side. No clicking, no crepitus, no problems there. I'm going to check your neck range of motion while we're here and have you look down at the floor, up at the ceiling, side to side, rotate your neck. Any pain with that? Range of motion of neck is intact. Then we're going to move to your chest. So just looking at her anterior chest, we're again looking for rashes, lesions, masses, any rib protrusions, any accessory muscle use with breathing. Her breathing's non-labored, no accessory muscles. Chest expansion is symmetric. Then we're gonna go ahead and palpate for any masses or depressions, any issues. Can you say 99 for me?
99.
And again?
99.
Great. tactile fremitus is present. I'm gonna go ahead and listen to your lungs now. So I'll have you take some deep breaths. Lung sounds are clear, no adventitious sounds. I'm gonna go ahead and listen to the 5 points of your heart, starting with aortic, pulmonic, Erb's point, tricuspid, mitral, and PMI. And heart is regular rate and rhythm, normal S1, S2, no extra beats, no murmurs, no gallops, no rubs noted. Great, so now we're gonna move to your posterior back. And again, we're looking for any masses or lesions, rashes or discolorations. We're going to go ahead and palpate the back, again, looking for any masses or lesions, and I don't feel any. I'm gonna test for chest expand or thoracic expansion. Go ahead and take a deep breath. All right, perfect. Thoracic expansion is symmetric. We're gonna go ahead and percuss over the lung fields. And lung fields are resonant. All right, I'll have you just say 99 for me.
99.
Again.
99.
Again.
99.
Perfect. Now we're gonna listen to your lung sounds. Go ahead and take a deep breath for me. Great. And then I'll have you say Mickey Mouse.
Mickey Mouse.
Again.
Mickey Mouse. Mickey Mouse.
All right. Breath sounds are clear bilaterally, no adventitious sounds. When she was speaking, it was muffled. There's no bronchophony, egophony, or pectoraliquy. So that is perfect. I'm gonna have you turn back around. And before we forget, Joanna, let's go ahead and test your hearing. So I'm gonna have you cover up an ear, and then I'm gonna whisper from over here, and you just repeat back to me what I said.
LQ5.
Great, and then your opposite ear.
8E9.
Perfect. And then I'm gonna go ahead and do the Weber test as well. I'm gonna place this on your scalp, and then you'll just tell me if the vibration sounds the same in each ear, okay?
Yep.
Perfect. Don't wanna forget about the ears. Okay. I'm gonna have you go ahead and lie down, and we're going to go ahead and move on to your abdomen. And first thing first is an inspection, any discoloration, any obvious masses or lesions. Stomach is flat. We're gonna go ahead and listen to bowel sounds. All 4 quadrants. Bowel sounds are normal, active. I'm gonna go ahead and listen to arteries, aortic, renal, iliac, femoral. No buoys heard. I'm gonna go ahead and palpate your femoral arteries, Joanna, while we're here. Arteries are 2+ and expected. Perfect. We're gonna percuss in all 4 we're gonna palpate first. A light palpation, noting any tenderness or guarding from the patient, any masses or lesions. And then we'll move to a deeper palpation. Great. No masses or lesions, no tenderness. We're going to palpate for your liver, hand under, and then we're gonna bring here, try to push your spleen up against your abdominal wall here. Okay, and then your kidneys, I'll have you take a deep breath in. Great. Organs, non-palpable, which is good, that's normal. Then we're gonna percuss in 2 spots. Most areas tympanic, of course, dull over the major organs like the liver. Okay, I'll go ahead and have you sit up for me. All right, so now we're gonna do the rest of your neurological exam and do some cerebellar function tests. So first things first is hands on your legs, and then you're gonna flip them rapidly back and forth. Great. Okay, stop. And then finger to nose, and then touch my finger, nose, my finger, other hand, nose, my finger, nose, my finger. Great. Everything was smooth and accurate there. We're gonna go ahead and do the Romberg test. I'll have you stand up and we'll check your balance. Go ahead and close your eyes. I'll have you maintain your balance for 60 seconds. And then I'm gonna check your gait. We'll do a heel to toe walk. Check for steadiness. Perfect, great. You can go ahead and have a seat. Now we're gonna test your sensation. First things first is we'll check sensation to your face. So I'll have you close your eyes and you'll let me know if it's sharp or dull, okay?
Dull. Sharp. Dull. Dull.
Great. Now we're gonna do your arms and your legs.
Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull.
Great. Sensation is intact to all 4 extremities. Now we're gonna check deep tendon reflexes. So first one is your bicep. Great, and then we'll do your tricep. Great, bicep, tricep, and then we're going to do your brachioradialis on both sides. Perfect. I'm going to go ahead and palpate your brachial arteries. Perfect, 2+, and your radial arteries. Those are 2+ as well. Reflexes so far have been 2+ and active. We're gonna do patellar. Great, 2+ active. I'm gonna feel your popliteal arteries, and those are 2+. Then we're gonna do your Achilles. Great, other side. Great, 2+ active. Gonna test your plantar reflex and look at those toes with the heel of my reflex hammer, or the handle rather. And then I'm going to go ahead and palpate your dorsalis pedis and your posterior tibial arteries, which are all 2+. So all of that looks great. And then lastly, we're going to look at your musculoskeletal system. I'm going to have you turn and I'm going to assess your spine. Everything is in a normal alignment. There's no curvature to the spine. Nothing is bulging. I'm going to go ahead and palpate along your spine. Let me know if anything feels tender. Good. All right, you can turn back around. I'm going to have you shrug your shoulders, and that tests cranial nerve 11. Have you push on my hands. Great, strength is 5 out of 5. Shoulder ROM is intact. I'm gonna have you go ahead and bend your elbows and bring them down. Bend your elbows again. Push against me, pull me towards you. Elbow strength is 5 out of 5, and range of motion is intact. I'm gonna have you go ahead and squeeze my hands. Great. Try to pull me towards you. Try to push me away. Great. Do this with your fingers. Perfect. I'm gonna have you spread your fingers, bring them together, hands down, up, side to side. Wrist and hand range of motion appear intact, and push against me and pull me towards you again. Great. Hand strength is 5 out of 5. Go ahead and lift that knee up. Lift the other knee up. Straighten both legs out and bend your knees again. Push up on my hand. Push up on my hand. Knee range of motion is intact and strength is 5 out of 5. Okay, bring this leg up. Don't let me push it down. Bring this leg up. Don't let me push you down. 5 out of 5 strength. I'm gonna have you go ahead and put your toes towards the ceiling and then feet towards the floor. Okay, now push up on my hands, push down on my hands. Great, strength is 5 out of 5 in the feet and the ankles, and range of motion is intact for the feet and the lower legs as well. All right, I think we covered everything and you look good to go for your job. Any questions?
I don't think so. Thank you.
All right, thanks.
Okay, bye.